By confirming the physician's order, I'm going to perform hand hygiene. I'm going to identify the patient with 2 separate patient identifiers. I'm going to ask them if they have any allergies, if they're allergic to anything, for example, iodine. And then I'm going to provide privacy and explain the procedure to the patient. I'm going to make sure there's a good source of light and that I have a trash can within close distance. And I'm going to elevate the bed to a good working height. I'm going to ask my patient to lay in the supine position on their back with the knees flexed and the legs flat. I'm going to put my catheterization tray in between their legs. I'm going to open the tab that's farthest from me first. I'm going to open the sides next. I'm going to open the one that's closest to me last. I'm going to turn this so it's as square instead of a diamond. I'm going to take the sterile gloves and move them towards the end of the catheterization tray, not touch anything. I'm going to put my gloves on using the sterile techniques that we were taught. Might help out you turn my hand the right way. Okay. I'm going to take my sterile drape and place it shiny side down in between my patient's legs. Before I do that, I'm going to roll my hands to protect my gloves, and I'm going to put it in between my patient's legs. The same thing with the sterile drape with the hole in the middle, shiny side down. I'm going to set my equipment up. I'm going to open the swab sticks, place them on the tray, and then I'm going to get my lubrication, tear it, and put it on the tray also. I'm also, before I start the procedure, going to take the sleeve off, the protection sleeve off of the catheter, so I don't have to do it while I'm in the middle of the procedure. And while I'm doing this, I'll make sure that the catheter is not touching anything except for what's in the sterile field. What's in the sterile field. I'll take the cap off the syringe. I'm going to attach the syringe to the catheter. After I have everything set up, I'm going to use my non-dominant hand to place on the labia minora, and then I'm going to expose the urinary meatus. Now, since this hand is now contaminated, I cannot touch any of the other sterile instruments. And from cleansing the labia to the insertion of the catheter, I cannot let the labia close at all, or I would have to start over because it is now contaminated. I'm going to start by taking my first swab stick and cleansing the labia farthest from me. I'm going to pull the swab stick back to me around my sterile field. I'm going to drop it into a trash can. I'm going to take the second swab stick and wipe the labia closest to me. And then I'm going to do the same thing. Take the swab stick and avoid the sterile field and make sure I'm not touching my clothes. Also, lastly, I'm going to take the swab stick and wipe it down the middle And again, I'm going to avoid the sterile field. Now that I have it cleansed, I'm going to take my catheter about 3 inches from the tip, and I'm going to lubricate it about, I would say about 2 inches, or at least the very tip. I'm going to insert my catheter 2 to 3 inches, and I see urine, so now I'm going to insert another 1 to 2 inches, and I'm going to anchor it with my contaminated hand. I'm going to take my syringe, and I'm going to fill up the 5 milliliter balloon with 10 milliliters of water. Now I'm going to make sure I keep the pressure on the syringe, or else the water will run back into the syringe. I'm going to gently tug to make sure the balloon is secure. Now that I know it's secure, I'm letting go, and I'm going to unattach the syringe. Now I'm making sure there's enough slack, so if my patient moves, she will not hurt herself. The balloon won't come out or bust or anything. I'm going to attach the catheter with like a stat lock or another securement device to the patient's leg. And after I have it attached, I'm going to take the drainage bag, make sure all the coils are out, and I'm going to hook it onto my patient's bed frame. After I have that completed, I'm going to remove my gloves and perform hand hygiene, and then I'm going to document the time I finished the procedure, the gauge of catheter I used, the amount of water I put into the balloon, the color and the amount of urine I got into the drainage bag after I inserted it, and how the patient tolerated the procedure if there's any complications.